Thank you, Professor. Dear friends, the topic of my report today is artificial intelligence improves the quality of colonoscopy by colorectal cancer screening. Now start my report. The colorectal cancer is a very dangerous cancer. Globally, CRC ranks second in the number of new cases and deaths of all kinds of cancers. Nearly half of CRC patients have metastasis by the time they are diagnosed. The 5-year survival rate for patients who have developed metastasis is less than 20%. In mainland China, CRC ranks second in the number of new cases and 50th in the number of deaths caused by cancer. The average cost per hospitalization for CRC patients is about $18,000. Other loss caused by CRC are huge too. Screening for CRC to improve the diagnosis of precancerous lesion and early stage tumors is a key step to improve patient progress and reduce the burden of disease. CRC screening has become a public health policy in Tianjin since 2009. The target population for the screening is citizens between the age for 40 and 74. 3 years is a screening cycle, and 3 cycles has been complete. About 6 million people have been screened, and the early diagnosis rate of CRC increased by 20%. The public health policy has made Tianjin the largest set of CRC screening in Asia. While CRC screening has made great gains, the disease burden situation of CRC in Tianjin remains serious. Incidence rates of CRC in Tianjin increased from 19 per 100,000 in 2007 to 38 per 100,000 in 2019, an increase of 100%, ranking second in tumor incidence rate. The mortality rate of CRC in Tianjin increased from 1.57 per 100,000 in 2007 to 15.64 per 100,000 in 2020, an increase of 60.43%, rising from the fourth to the second place in the risking of tumor mortality. Why the current situation of CRC in Tianjin so seriously, despite the screening? One reason for these problems is that the main methods of screening is currently questionnaires and fit tests, and only 1.2% of all people are screened by colonoscopy. Currently, only 38 large hospitals can undertake a colonoscopy screening. On the other hand, community hospitals are not competent to perform colonoscopy screening because the lack of experienced doctors. Studies has reported a 23 to 35% poly missed rate on colonoscopy, resulting in interval CRC in 3 to 5% of patients that's been undergoing colonoscopy. The quantity and quality of colonoscopy screening needs to be improved. The implication of AI technology in the field endoscopy provide us the ideas to solve these problems. The application of AI technology in medicine is a major research hotspot. Deep learning-based computer-aided diagnosis in the field of endoscopy is receiving increasing attention. The current study report a sensitivity of 99.7% for polyp detection with AI-assisted colonoscopy, which can avoid most missed polyps. The technology has been approved by FDA in 2020. We also developed a deep learning AI assisted diagnosis system for colonoscopy. This AI system built based on about 8,000 colonoscopy images for training, and the number of images for training the model is still increasing. The AI system is integrated into a workstation and has been approved by NMPA. Currently, the AI system has the following functions. First, displaying colonoscopy images on the screen of the workstation, identifying and suggesting lesions in real time, saving and playbacking videos and screenshots of colonoscopy procedure, and counting data related to the quality of colonoscopy. Other functions are underdeveloped. In the function of displaying colonoscopy images, the system can synchronize with the colonoscopy with a low latency. This allows doctor to watch the workstation screen instead of the colonoscopy original screen. The AI system recognizes lesions in the colonoscopy images in real time and suggests the lesions on the screen. Currently, the AI system has a sensitivity of 94.74% for polyp detection, actively avoiding missed polyps. Doctor can quickly locate images content lesions with the colonoscopy video playback function to easily read colonoscopy reports. Doctors can also explain the condition to patient visually by playing back the video. At the end of the colonoscopy, the AI formed a report on the quality of colonoscopy. This report contains data to evaluate the quality of colonoscopy, such as exam time, colonoscopy with short time, intestinal cleanliness, and numbers of screen shots, and so on. The clinical study related to this technology was a part of National Key Research and Development Program. Related studies showed that the colonoscopy detection rate of polyps increased from 56.3 to 78.1% with the AI system. And the adenoma detection rates increased from 29.7% to 53.1%. For every 1% increase in adenoma detection rate, CRC incidence decreases by 3%. AI technology can improve the quality of colonoscopy screening by increasing the rate of polyp detection, reducing the rate of missed polyps, recording and evaluating data related to the quality of colonoscopy, and referring to colonoscopy radios to form high-quality screening reports. Doctors in community hospitals can also perform high-quality colonoscopy screening with the assistance of AI system. More people will be screened by colonoscopy in community hospitals. Patients undergoing colonoscopy screening has a better experience with the service of the AI system. The increasing polyp detection rates has also led a greater emphasis on colonoscopy screening and a better patient compliance with CRC screening. With these experts, the AI system will help us increase the number of colonoscopy screening. AI technology will continue to be improved as the number of cases increase. With the development of AI technology, the cost will become less and less. It will become another public health policy, and the cost of this technology will be covered by health insurance in the future. With the development of the AI technology, the quality and the benefits of CRC screening will continue to be improved. That's my report today. Thank you for listening.